Osteoarthritis. What to know? Osteoarthritis causes inflammation in the joints and the breakdown and gradual loss of joint cartilage. As the cartilage wears down, a person experiences pain and difficulty with movement. Osteoarthritis is a common joint disorder. It develops in the hand. For example, in 1 in 12 people over the age of 60, according to the Arthritis Foundation. Osteoarthritis is a progressive disease, which means that symptoms worsen over time. There is no cure, but treatment can help manage pain and swelling and keep a person mobile and active. Symptoms. Osteoarthritis leads to pain and stiffness in the joints. In the early stages, a person may have no symptoms. Symptoms may occur in one or more joints and they tend to appear gradually. When symptoms develop, they can include pain and stiffness that worsen after not moving the joint for a while. Swelling, difficulty moving the affected joint, warmth and tenderness in the joints, a loss of muscle bulk, a grating or crackling sound in the joint known as crepitus. The progression of osteoarthritis involves synovitis, mild inflammation of the tissues around the joints, damage and loss of cartilage, bony growths that form around the edges of joints. Effects. Cartilage is a protective substance that cushions the ends of the bones in the joints and allows the joints to move smoothly and easily. In people with osteoarthritis, the smooth surface of the cartilage becomes rough and starts to wear away. As a result, the unprotected bones start to rub together, causing damage and pain. Eventually, bony lumps form on the joint. The medical names for this are bone spurs or osteophytes, and they can lend a knobbly appearance to the joint. As the bones change shape, the joints become stiffer, less mobile, and painful. Fluid may also accumulate in the joint, resulting in swelling. While osteoarthritis can develop in any joint, it commonly affects the knees, hips, hands, lower back, and neck. The knees. Osteoarthritis usually occurs in both knees, unless it results from an injury or another condition. A person with the condition may notice that there is pain when walking, especially uphill or upstairs. The knees lock into position, making it harder to straighten the leg. There is a soft grating sound when they bend or flex the knee. The hips. A person with osteoarthritis in the hips may find that any movement of the hip joint, such as standing up or sitting down, can cause difficulty or discomfort. Pain in the hips is a common feature of the condition. Osteoarthritis in the hips can also cause pain in the knee or in the thighs and buttocks. A person may experience this pain while resting as well as while walking. For example, the hands. In the hands, osteoarthritis can develop in the base of the thumb, the top joint of the other fingers closest to the nail, the middle joint of the other fingers. A person with the condition may notice pain, stiffness, and swelling in the fingers, bumps that develop on the finger joints, a slight bend sideways at the affected joints, fluid-filled lumps or cysts on the backs of the fingers which may be painful, a bump that develops where the thumb joins the wrist, which can make it difficult to write or turn a key. For some people, the finger pain decreases and eventually goes away, though the swelling and bumps remain. Anyone who experiences joint stiffness and swelling for more than 2 weeks should see a doctor. Causes. Doctors do not know the exact cause of osteoarthritis, but it seems to develop when the body is unable to repair joint tissue in the usual way. It often affects older people, but it can occur at any age. Genetic factors. Some genetic features increase the risk of developing osteoarthritis. When these features are present, the condition can occur in people as young as 20 years old. Trauma and overuse. A traumatic injury, surgery, or overuse of a joint can undermine the body's ability to carry out routine repairs and may trigger osteoarthritis, eventually leading to symptoms. It can take several years for osteoarthritis symptoms to appear after an injury. Reasons for overuse or repeated injury include jobs and sports that involve repetitive movement. Risk factors. A number of risk factors increase the chances of developing osteoarthritis. Sex. Osteoarthritis is more common among females than males, especially after the age of 50. Age. Symptoms are more likely to appear after the age of 40, though osteoarthritis can develop in younger people after an injury, especially to the knee, or as a result of another joint condition. Obesity. Excess weight can put strain on weight-bearing joints, increasing the risk of damage. Occupation. Jobs that involve repetitive movements in a particular joint increase the risk. Genetic and hereditary factors. This can increase the risk in some people. Other conditions. Some diseases and conditions make it more likely that a person will develop osteoarthritis. Inflammatory arthritis such as gout or rheumatoid arthritis. Paget's disease of the bone. Septic arthritis. Poor alignment of the knee, hip and ankle. Having legs of different lengths. Some joint and cartilage abnormalities that are present from birth. Diagnosis. A doctor will ask about symptoms and perform a physical examination. No definitive test can diagnose osteoarthritis, but tests can show whether damage has occurred and help rule out other causes. Tests may include X-rays and MRI. This can reveal bone spurs around a joint or a narrowing within a joint, suggesting that cartilage is breaking down. Joint fluid analysis. A doctor will use a sterile needle to withdraw fluid from an inflamed joint for analysis. This can rule out gout or an infection. Blood tests. This can help rule out other conditions such as rheumatoid arthritis. Lifestyle tips. A range of strategies can help ease the symptoms of osteoarthritis. Ask the doctor for advice about suitable lifestyle adjustments. They may recommend exercise and weight control. Exercise is crucial for maintaining mobility and range of movement, improving strength and muscle tone, preventing weight gain, building up muscles, reducing stress, lowering the risk of other conditions such as cardiovascular disease. Current guidelines recommend that everyone should do at least 150 minutes of moderate intensity exercise each week. A doctor or physical therapist can help develop an exercise program, and it is important to follow their instructions carefully to prevent further damage. Choose activities that will not put additional strain on the joints. Swimming and other types of water-based exercise are a good way to keep fit without putting additional pressure on the joints.